Hi, I'm Dr. Vivek, the hair restoration surgeon at Cosmetic Studio. We get a lot of mails asking us various questions on hair loss and hair thinning. It is a major problem and it affects about 7 out of 10 males and 3 out of 10 women. And the purpose of this video is to help you to understand what is the difference between hair loss, hair thinning, and what are the treatment options that we have available today. What is the difference between hair loss and hair thinning? Hair loss could be a normal hair loss and an abnormal hair loss, whereas hair thinning is characterized by thinning of the hairs which is a permanent thinning, and the hairs don't grow back again. Most of us shed between 30 to 100 hair strands every day. This could be normal and not a cause for worry. Only when the number exceeds about 100 hair strands every day, then we need to consider whether there is a disease factor which is causing hair loss. Hair thinning, on the other hand, is a progressive disease and it is considered as androgenetic. It is a combination of faulty genes with hormones wherein the hairs start getting thinner and thinner, the density keeps reducing, and ultimately it comes to a stage where the hairs stop growing at all and you have baldness appearing on the scalp. What is an ideal treatment for people who have hair thinning? An ideal treatment for people who have hair thinning could be medical and surgical. Medical option is the first line of treatment, especially in youngsters. We use a combination of lotions, tablets, and even now platelet-rich plasma to try and induce the hair growth. If hair growth happens with medical line of treatment, it is fine. But if it doesn't, then surgery is the next option. Finasteride, a drug which is available, prevents dihydrotestosterone from destroying existing follicular units on the scalp and thus prevents further thinning of the hair. However, finasteride needs to be taken for a longer period of time because it only blocks the effect of dihydrotestosterone. It doesn't eliminate this hormone. Hence, if you stop finasteride, the thinning of hair continues from the next subsequent day. Hair transplant is the only option once a significant baldness has set in, and it works well because we use follicular units which do not get destroyed by dihydrotestosterone hormone. So what is hair thinning? Hair thinning is caused by a hormone called dihydrotestosterone, which is a metabolite of a hormone testosterone which is there in the skin. In androgenetic male pattern baldness, it is this dihydrotestosterone which attacks the hair follicles, the roots of the hairs, and hence the roots manufacture hairs which are smaller and smaller. Smaller hairs are considered cosmetically not very suitable as they are very thin, and this is what results in baldness. What is the age at which hair thinning can start? In my clinic, I have seen patients as young as 18 years coming to me with androgenetic hair thinning. It can extend right up to 30 to 40 years. Sometimes we have androgenetic hair thinning starting even as late as 40. What are the medical treatments available for androgenetic hair thinning? The main treatment is medical, and the sooner we start, the better we are able to control. There are two US FDA approved medicines which are available, which is minoxidil and finasteride, and these medicines are known to stop the effects of dihydrotestosterone hormone and even make the existing hairs grow thicker over a period of time. What is the reason why a hair transplant is required? After medical line of treatment, or if in people who have delayed medical line of treatment, various degrees of baldness have already set in. The balding patterns can start either in the front or in the back, and they can converge to create varying degrees of baldness. Who are ideal candidates for hair transplant? Ideal candidates for hair transplants are people who are ideally over 25 years of age, who have various degrees of baldness on the scalp, and these are patients who would benefit from hair restoration. Another indication for hair transplant is in patients in whom the medical treatment has failed to produce hair and baldness has set in. How does hair transplant work? We have genetically programmed hair follicles which in the front are destroyed by dihydrotestosterone, and we have hair follicles in the sides and in the back which are not destroyed by dihydrotestosterone. Hence, when we remove follicles from the back and transplant them into the front, these follicles grow well as they are not destroyed by dihydrotestosterone and they produce normal hair grafts, and these tend to be permanent. This is one of the main reasons why hair transplant is an excellent option for hair restoration. What are the treatments available for hair restoration? We have medical options and surgical options. Medical options include lotions and tablets, and surgical options include hair transplant surgeries. When we look at hair transplant surgeries, the donor area for the hair follicles is usually the back portion of the scalp. This is a portion that is chosen because dihydrotestosterone doesn't kill the grafts in the back. There are two techniques for hair restoration, one which is the traditional strip technique and the other one is the follicular unit extraction technique. In a strip technique, we take a strip of hair from the back portion of the scalp. These are then cut under a video microscope to give us the hair grafts, the follicular units, which are then transplanted onto the front. Follicular unit extraction is a relatively newer treatment that's available where individual follicular units are extracted. In our clinic, we use NeoGraft, an automated device which makes a cut on the skin and sucks the follicular unit out intact. With the advantage of NeoGraft over the other techniques for extraction include very less damage to the grafts, and majority of the grafts are not damaged during the extraction process. Either with a strip or with an extraction, there is always a limit to the number of grafts that are available for transplant in a sitting. In the traditional strip technique, in our clinic, we go up to 3,500 to a maximum of 4,000 follicular units in a sitting. Whereas in an extraction technique, even if there is a huge donor area that's available, up to 2,000 to 2,500 grafts can realistically be extracted and transplanted. Which technique suits you depends on the extent of baldness that you have. If your requirement is up to 2000 to 2500, an extraction technique is advisable. Whereas if your requirement is approximately between 3500 to 5000 follicular units, then a strip technique makes sense. When do the follicles grow following a transplant? It takes about 3 to 6 months for the follicles to start sprouting following a hair transplant surgery, and around 9 months for the final results of a hair transplant to be seen. So most of the clients normally have a haircut about 9 months following a hair transplant. What are the side effects of hair transplant? Though there are no permanent side effects with a hair transplant surgery, the temporary side effects can include dull pain, especially in a strip technique, for 1 or 2 days. Mild swelling on the forehead is usually seen either in a strip or an extraction technique, which lasts for about 2 to 3 days and gradually disappears. The main problem with a badly done hair transplant is scars either in the front or in the back. We can avoid scarring in the back with a trichophytic closure and using video microscopes to make the grafts as small as possible. A smaller graft requires a very small cut in the front, which is hardly visible when it heals. In follicular unit extraction, scarring is hardly visible as individual follicular units are extracted.